Endoscopic sinus surgery represents a major innovation that avoids facial scars, radical tissue removal, and blind procedures. True cutting forceps and tissue microdebrider devices helped us to spare mucosa and improve healing. Despite these advances, problems such as bleeding, scarring, and orbital and intracranial complications still occur. Balloon sinuplasty is a catheter-based approach introduced to reduce the mucosal trauma, scarring, bleeding, and other associated sequelae. This innovative concept was prompted by the success of catheter technology in other medical disciplines including cardiology, urology, and vascular surgery. Presently, a number of authentic studies are getting published in journals regarding the satisfactory safety profile of this technology. It is a proven technology with the FDA approval, and American Rhinology Society has clearly pointed out that this is a safe and acceptable procedure and is better considered as an additional tool for endoscopic sinus surgery. You may require concurrent conventional endoscopic sinus surgery, especially in ethmoid sinus. These are the sinuplasty devices. These are the sinus catheters with varying angle tips and varying diameters of different sizes. These are the sinus guide wires with radiopaque inner coil and atraumatic malleable tips. This is the sinus balloon catheters available in various sizes to pass over the guide wires through the catheters to widen the various sinus ostia effectively. Sinus irrigation catheters help to wash the sinus cavities with saline or medicated solution. The balloon inflation device helps us to inflate the balloon at the sinus ostia with diluted radiopaque dye for effective and adequate widening. This short video clip shows maxillary frontal sinuplasty procedures including C-arm and postoperative views. Here you can see the maxillary catheter is getting placed into the right middle meatus behind the lower part of the uncinate process with the help of nasal endoscope. Once the catheter is in place, we can withdraw the endoscope. This is a C-arm view of the right maxillary sinuplasty. You can see the guide wire is getting pushed into the sinus cavity. Now I am withdrawing the excess king guide wire from the sinus cavity. After positioning the guide wire in place, the balloon catheter is introduced over the guide wire. The position of the balloon is adjusted in the natural ostium by noting the two radiopaque dots of the balloon in the C-arm. After confirming the position of the balloon, we will load the inflation device with 8 cc of diluted radiopaque dye. After this, we will inflate the balloon to a pressure of about 10 to 12 atmospheres so that the ostium is adequately widened. After keeping the inflated balloon in position for 10 seconds, we will deflate the balloon and take it out, keeping the catheter and guide wire in position. If you want to irrigate the sinus, you can pass the irrigation catheter over the guide wire and wash the sinuses. This is the left frontal sinuplasty. You can see the frontal catheter is getting placed in the upper part of the middle meatus behind the uncinate process anterior to the bulla. Once the catheter is in place, nasal endoscope is withdrawn and get the C-arm view. Under the C-arm guidance, the guide wire is passed into the frontal sinus. Here you can see the guide wire in the right frontal sinus. The balloon is introduced over the guide wire as in maxillary sinuplasty into the frontal recess area. The position of the balloon is confirmed as in maxillary sinuplasty. After correct positioning, we will inflate the balloon for 10 seconds. As we did in maxillary sinuplasty, after adequate widening of the frontal recess area, the balloon is deflated and withdrawn. This is the postoperative endoscopic view of the widened left maxillary sinus ostium. And this is the right maxillary sinus ostium 1 week after the procedure. This is the widened lower part of the left frontal recess area 2 weeks after the procedure. From our short experience, I conclude that balloon sinuplasty can be used as an additional tool for endoscopic sinus surgery, especially for widening the frontal recess area. It can also be considered as a safe, minimally invasive and supposed to be effective procedure for treating chronic sinusitis patients. Let me express my sincere gratitude to Professor Mohan Kameshwaran, who taught me the basics of sinuplasty. I am also thankful to Ms. Sandy and her team from US for giving me the cadaver training in sinuplasty from Singapore General Hospital. Thank you all.